Welcome to the Move with Tank podcast with your host, Dr. Michael Tansini. He is a doctor of physical therapy, owner of Ground to Overhead Physical Therapy, a strength and conditioning coach, former college athlete, 4-time CrossFit regional athlete, and a national level Olympic weightlifter. On the show, he will cover ways for active individuals and athletes, just like you, to stay healthy and improve their performance without the need of surgery, injections, and pain medication. If you ever have any questions for Dr. Tansini, which you would like answered, send over an email or message through Instagram at drtank_DPT. So without further ado, here's your host, Dr. Tank.
What is up, guys? Dr. Tank, Dr. Tansini here. Welcome to season 3. This is the 3rd season of the Move with Tank podcast. Man, a lot has happened in ground overhead PT and in my life since season 2 ended. I got a bunch that I want to share with you guys, and I want to introduce you guys to a few new things that have been going on at a ground overhead PT. So first and foremost, I want to introduce our new team member, Dr. Brett Rolison. He is awesome. I got him here on the show with me. Brett and I, we're going to be tag teaming a lot of these shows together, trying to answer questions for everyone, bring a clinical perspective, see if we can help guide you guys through some different causes and treatments, and just so that you guys have a better idea on the path forward based off of these specific questions. So remember, if you guys have questions, send us over a message on Instagram, and we will answer your question on the show as well as right back to you. And we're going to be coming at you guys one day every week. It'll come out every Thursday. It'll be a mix of us answering questions for you guys and bringing on some really awesome guests. We've got almost the entire season done so far. And, man, I'm super pumped to get these shows out to you. There's a lot of awesome things happening around the triangle. So, but before we jump into our first question of the season, Brett, what's up, man?
Hey, how's it going? Thanks for having me on, and excited to answer a few questions.
Yeah. So everyone, Brett is going to be, Brett's the newest member at Ground to Overhead PT. So Brett, so tell everyone, man, a little bit about yourself.
Sure. Well, obviously I'm a physical therapist, strength and conditioning coach as well. Kind of my 2 groups of athletes I really like working with are my tennis players and hockey players, along with functional fitness athletes. So kind of my background, I played hockey growing up. That was kind of my main sport. I was always active, but that was the sport I played. Then I went off to grad school. I met my now girlfriend, who was a pro tennis player at the time. She's now retired. And she's the one who got me really into tennis. And then I've always just been involved with some kind of, I've done everything from CrossFit to Olympic lifting, bodybuilding, and cycling, long distance running. So just kind of every couple of years, I kind of dive into something new, get really into it until I kind of burn myself out and then move on to the next activity. And so I just like to stay active and like to work with people that are active.
Sweet, man. What's your thing right now? What's the thing you're diving into now?
So during the pandemic, because the gyms were closed, I got really into ultra running. So it's, anything over 26 miles. So I was doing a ton of running with the gyms closed and just doing some like playground workouts on the pull-up bars. And then now the gyms are open, I've gravitated back towards lifting, trying to get stronger, build my squat, deadlift, and all that. And just doing cardio on the side to stay healthy, but more lifting now.
Gotcha. So do you treat your squat every day as as your cardio?
Yeah, so I've slowly tapered away from the squat every day. So yeah. Knees were starting to back at me, so now I'm following Sonny Webster, the Olympic lifting Olympian, following his squat program that someone sent over to me, and it's much more appropriate, like 2 or 3 days a week. So, and it's got all your accessories and hinge movements and some Olympic lifting in there. So, yeah.
Sweet. Awesome, man. Now, so you played hockey, now have you, what'd you do prior to coming on at ground overhead?
So I went to school at Campbell. So back in the day, I right after undergrad, I had always planned I was going to go to PT school. And I was like, well, I'll just take a year and see what I want to do. And I had a friend who had a position at their company, and I just went and interviewed and got the job. And so that 1 year turned into 5 years. I was a inventory analyst over at a company, like an ExxonMobil partner company, and working in a cubicle 8 hours a day. And I absolutely hated it. So I was like, what am I doing in my life? I can't do this for another year. I can't spend another day in this cubicle. So I started taking night classes and said, all right, I'm going to go back to PT school. So that was 5 years ago, and went to PT school. And then, it's just 3 years of trying to figure out what is PT exactly, and who do I want to work with, and where am I going to find my niche, and what am I going to do that I knew I wanted to do something to make me happy because I was so miserable in my old job. And I've always known I've always been an active person, always loved working with people. I was a personal trainer way back in the day in undergrad. And so it just kind of felt pretty natural for me to eventually go down the PT route. I'm glad I did.
Awesome, man. So what's your favorite part of working here at Ground Overhead?
Probably when people write me emails or tell me towards the end of our sessions that they're just feeling so much better, because I spend a lot of time planning what I'm going to do with people. And it's not like I just, roll in that morning and just kind of without a plan. I really try to spend a lot of time thinking about every person I work with and what specific route we need to take to get them better. And so when that pays off, it's completely worth it. So
that's awesome, man. It's awesome. And would you say the people we work with are pretty awesome?
Oh, yeah. I mean, everyone I work with, it's a lot of the same stories. Being active is, most of us aren't professional athletes. We're just people that love working out or love exercising or playing sports because it's who we are and it makes us feel better, and we want to age well and feel good. And so I think we both can relate to that a lot. And so, it's like talking to one of your friends from the court or on the ice or in the gym.
Sweet, man. Well, all right. So now, how often do you think we hear and see golfer's elbow here in the gym or here in our practice?
It's probably a top five diagnoses in the clinic.
Yeah. So we see a lot of this, and it's like a golfer's elbow, but it's normally not a golfer coming in. It's normally having to do with some kind of CrossFitter, a weightlifter, functional fitness athlete. They're the ones who actually tend to get that golfer's elbow, and to the point to when golfer's elbow should be probably called also CrossFit elbow. So, all right, man, ready to dive into our first question because this is exactly what we're talking about today. So, everyone, I got this question or this question popped up on a training group that I'm personally a part of in the water cooler section. This athlete was asking for some advice, and I thought, hey, what better question to answer on our first show than this one here, because the amount of time that we actually work with people on this exact thing. So here's the question. And Brett, I'm going to read out the question. I'm going to let you take it, run with it, see what your thoughts are. And then I'm going to kind of filed up in the back. Okay. And everyone, Brett really hasn't really even seen this question. So this is, he hasn't had much time to prep off his head for this. This is just something he knows off the back of his hand. So, all right. So the question is, I've been having an elbow tendonitis issue that's been building for the past 2 to 3 months. It's more of a golfer's elbow issue because it's more on the inside of the forearm. Things like cleans, jerks, snatches, strict pull-ups, upside down work seem to aggravate it the most. I've been able to suck it up and push through it on most things, but definitely not getting better. Any thoughts on what I can do to help with the pain and make it go away? What do you think, Brett?
All right. So first things that come to mind, well, first off, it's super, super common, like you said, with CrossFitters or functional athletes or anyone who's doing a bunch of like barbell work or like a bunch of work on the rig, like bar muscle ups or toes to bar or pull ups and all that. First couple things come to mind is looking at what's happening up the chain. So looking at the shoulder. So we know if you're not as mobile or stable as you need to be in the shoulder, you're actually going to put a lot of forces on that elbow. Taking them through some kind of mobility screen and seeing how well is that shoulder rotating. Can they get into a good front rack position? Can they get into a good overhead position? Can they get down into, like, if they're doing like ring dips, can they get in that good like extended shoulder position? And if that shoulder's not moving as well as it needs to, what is happening at the elbow to compensate? And then vice versa, looking down the chain at the wrists and saying, okay, like, are they those people that have no wrist extension? So now they're cranking that elbow to try to get under the bar, or are they someone that have to do front squats, holding it here because they can't get the shoulder range of motion in front rack? So looking at the shoulder and say they have great mobility and great stability, then saying, okay, what has changed in your training? So like, have you had a huge increase in volume? A lot of people, like, coming out of quarantine have basically gone from doing just about nothing to trying to get back to their old self 2 years ago. So they've doubled the volume, and it could be you have great mobility and stability of your elbow, wrist, and shoulder, but the volume's too much, and you've created this chronic tendon issue that's gone from inflammatory, like itis, tendonitis, to more of a chronic, degenerative, progressive issue like tendinopathy.
Yeah, man. Dude, you're spot on there. You know, like, I mean, with athletes, we see, you know, this medial elbow pain a lot with CrossFitters, a lot with Olympic weightlifters. And just like Brett, you were saying, like, it comes down to one, positioning. So can the person get into that good front rack or that good overhead position without compensating at the elbow? Now, with this athlete, you know, they said there was both cleans, jerks, snatches, strict pull-ups, upside down work. So that leads us in to be like, okay, like cleans, like how's that front rack? Jerks, once again, how's that front rack? But also, how's the overhead positioning? Because as we know, like, when you're locked out up overhead, like, if that shoulder is pretty funky, and you can't generate the positioning at the shoulder needed, you're going to put a super ton of stress right on the inner part of that elbow, which can then give you pain when you're up overhead. You know, pull-ups, right? You know, we've got to look at there. So pull-ups, said strict pull-ups, and which leads me to believe, like, one, it's probably not the pull-up that's actually doing it, but with all the forearm muscles connecting right on the inner part of that elbow, you will see, and some of the pullers also connecting towards the inside of that elbow, we will see then an overload of the tissues and just giving the tissue a little bit more they can handle. So it's more of like a capacity problem at that point with the tissues. You know, like, this athlete also said that upside down work also aggravates it. Remember, when you're upside down, you're up overhead in that overhead locked out position. If there's something funky going on at the shoulder, right, it's going to put a lot of tension on the inner part of that elbow. So Yeah. So Brett, you hit it spot on. Like this athlete, it's been happening for 2 to 3 months. We have to first look back. Okay, like what was the trigger? Because these mobility and stability problems were probably there before this came on. And sure, like they might be setting the table for this to happen, but there's some kind of loading or volume trigger there, which is then causing this athlete problem. So one, identifying that. Two, being able to figure out, okay, like, are there these mobility deficits and stabilization issues, so that one, you can start working on the underlying issues of what's actually going on, so that you can take pressure off the inner part of that elbow. Three, right? We have to look at capacity. So capacity of what the tissue is actually capable of. What we've seen is the athlete's gone past the tissue capacity that she can handle, and it's now aggravating her, and it's just not getting better. And three, or lastly, right, we've then got to work with that athlete on ways in which she can modify training so that she can still see progress the way that she wants to, but also while giving her the ability to gradually load that tendon and gradually load that medial elbow, so that she can get out of a painful state, but also get it back to the capacity which she actually needs. Would you say that's what you had in mind, Tim?
Yeah, I think a lot of the people I talk to, I think there's really only two options: either quit what they're doing altogether for a month or two and just rest, or two, just push through the pain. And really, neither are really the route you want to go down. More controlled loading, addressing the mobility issues, the stuff you picked up on or touched on, and loading it in a way that you start to strengthen and build the capacity of those tendons will go much further than just rest. So,
yeah. So, all right. So we got about one minute left here. What's, if you were to tell this athlete, two things that she should be doing, what are they?
So I would do some kind of soft tissue work. So if it's a lacrosse ball, peanut, tennis ball, just getting it in on the inside of that elbow, not on the bony prominence, but just distal or down towards the wrist a bit, a couple inches, and then working all the way up till you're a couple inches above the wrist, spending a little bit of time. You can either work the ball all the way down, or you can pin it down onto the wall or onto a table and floss that wrist back and forth, floss the fingers back and forth. And then I would take that lacrosse ball and I would start doing some kind of mobility work at the shoulder, whether that's pinning down the lat or the pec and going through that overhead position. Or you could try isometrics. So we know, like you said, those tendons are going to flex the wrists, fingers, and some of the pulling motion. Doing some kind of isometric that is like 60 to 70% of your capacity, and holding it for a long time, like upwards of 150 seconds, but using pain as an indicator. So if we think 0 is no pain, 10 is emergency room, somewhere in that 0 to 3 range where maybe you feel a little bit, but it's not sharp stabbing, you're not grimacing, it's not beating your head against a wall type pain. Yeah.
Awesome, man. Yeah. Those are all great things and would definitely help this athlete a lot, probably. So now, I'm going to second that. Like, one, get it freed up a little bit better, just so it feels a little bit better. Two, start looking at the positioning, like first, go after a mobility up overhead, but also think about, okay, like if this athlete, I've never seen her, we've never seen her, but if she's super hypermobile, maybe like she just doesn't need to do mobility and she just needs to get a better overhead position and a better front rack position. And then three, begin to load it a little bit. So begin to load it with that isometric, begin to load it with like a dumbbell wrist curl on a super slow tempo to try and gradually help that tendon heal. Modification in her program is crucial. Being able to, give her a little bit of pulling stimulus so that she can continue to make goals towards her training goals, but also, being able to throttle back enough to actually get her back in the positive adaptation of what she's doing so that she can get over this pain and help it feel better. Lastly, I say to this athlete, know that this isn't going to be a binary lights on, lights off, pain on, pain off type deal. The elbow is going to stay cranky for quite a while, but we really want to look at these different objective measures with pain and loading tolerance to help you get all the way back to what you're doing. I would say from a performance standpoint, this is something you definitely want to take care of, as we know CrossFit is highly pulling, has a lot of pulling in it. And if you have pulling or you have elbow pain when you're trying to grip and pull, your forearm strength and forearm endurance and pulling strength and pulling endurance are going to be a lot less, and which will negatively impact you when you're competing. So, yep, that's all I got. Brett, you got anything else, man?
No, I think that's good advice, especially setting the tone of I think a lot of people think either something's really messed up with their elbow or it's going to go away like next week. And with tendonitis or golfers or tennis elbow, you're looking at several months to really get it pain under control and start to see your capacity go up and your performance increase. But like you said, looking for that kind of objective progress week to week.
So awesome, man. Well, that's our question for the week. Remember, if you guys have any other questions, shoot them on over. Brett, man, I'm super pumped to have you on the show with me. Super pumped to have you in the clinic. I really couldn't have asked for a better person to team up with to help improve people's lives. And dude, thank you so much for coming on multiple fronts. And I'll let you get to that next individual you got coming in. But awesome, man. Brett, thanks, man. And we'll make sure we get you on, or you're going to be on a lot this season. But they're gonna hear your next episode too.
Awesome. So thanks for having me, and looking forward to it.
Sweet. Awesome, guys. Remember, this is Dr. Tank, Dr. Tansini. We'll see you next time.
Okay, guys, thanks for listening to the podcast today. I hope you found the content useful, and I hope it helps you avoid an unneeded surgery or an unneeded injection in the future. Now, in practice, my goal is to save 1 million active individuals from the unneeded surgeries, injections, and pain meds that they don't need, while helping them stay active and performing the activities that they love to do. Now, guys, I cannot reach that many people all by myself. I really need your help. So if you like what you heard, please share this podcast with your friends, with your families, or with anyone who you feel really needs to hear it. By doing so, you may just save that person from an unneeded surgery or injection that they really do not need. If you're not following me yet on social media, find me on Instagram at drtank_DPT and on Facebook at Ground 2 Overhead Physical Therapy. Thanks for listening to the show today, guys. I hope you enjoyed it, and I look forward to seeing you guys here again next time on the Move with Tank podcast.